Hi everyone, my name is Calissa Muniz, and this project was completed under the guidance of Dr. Linda Batchelor here at Barry University in the School of Mental Health and Social Work. Our study is titled Long-Term Effects of Childhood Trauma on Adult Worry Patterns. So a little bit introducing the topic to you guys. Childhood trauma and worry are both important psychological topics that impact mental and physical health. Childhood trauma refers to distressing or harmful experiences that occur before the age of 18, such as abuse, neglect, or witnessing violence. According to the CDC, about 64% of adults in the United States have experienced at least one adverse childhood experience, and over 17% have experienced four or more. These early experiences can shape how people think, feel, and respond to stress later in life. While much of the existing research has focused on trauma and anxiety disorders, such as GAD or generalized anxiety disorders, there's very little work exploring on how trauma may influence everyday worry patterns in adulthood, even among those who don't have a formal diagnosis. So for this study, our study aimed to address this gap and explore how early trauma might predict or relate to higher levels of adult worry. So a little bit about some background to give a little bit of context in this scenario. Worry and generalized anxiety disorder, or GAD, are related, but they're not distinct, right? So worry is something that everyone experiences. It's the mind's way of planning or problem solving around uncertainty. But when worry becomes excessive, uncontrollable, and physically distressing and presents those physical symptoms, it can cross the line into GAD. So there are several theoretical models that I spoke about in my literature review. The first one is the avoidance model. This suggests that worry acts as a mental avoidance strategy, and people worry to distract themselves from distressing emotions or fear. The second model is the cognitive model. This focuses on how negative thinking patterns and attention biases keep worry going in kind of like a cycle. And then the last model is the developmental model, and this highlights how worry evolves as children grow. So suggesting that early experiences and emotional learning, including trauma, playing a role in how people manage uncertainty and stress. So there are very few studies that I've found in research that have shown that people with higher levels of childhood trauma tend to score higher on measures of worry, and even when they don't have clinical anxiety. So this suggests that trauma may change the way that individuals process emotion and perceive safety or anticipate future threats. So what are some different types of childhood trauma? So, first, childhood trauma is the emotional response to distressing or life-threatening events, and the forms of it is physical, sexual, emotional abuse, neglect, exposure to violence, and accidents. So, a little bit of statistics and the prevalence. Over two-thirds of children at the age of 16 or by the age of 16 have at least one traumatic event. And then in 2022, 434,000 perpetrators of childhood abuse or neglect was collected data-wise, and neglect is the most common form, making up 74%. So what does this do psychologically and developmentally? So first, it disrupts the attachment relationships, leading to emotional and relational difficulties. It's also linked to disorders such as PTSD, anxiety, depression, and substance abuse. It also affects trust, intimacy, and emotional regulation going into adulthood. So what are some of the cognitive and academic effects? So there are learning difficulties, lower academic performance, higher expulsion rates. It disrupts the brain development and affects stress regulation and memory. And it also has some physical health consequences, so increased risk of chronic conditions such as diabetes, heart disease, obesity, and really affects and alters our stress responses, leading to long-term health issues. There's also long-term emotional and behavior patterns that are involved. So this is learning helplessness, and learning how to not deal with emotional distress, um, and behavioral challenges such as aggression or disengagement from school. However, there are risk and protective factors. These risk factors include poverty, domestic violence, repeated trauma, and some of these protective factors could be supportive relationships or family, having a stable caregivers, and just overall community resources. And what's really important is that resilience does play a key role in overcoming these traumas. So that's a little bit about the literature review there. Next, we're going to go into the rationale and the hypothesis. So the purpose of this study was to examine the relationship between childhood trauma and adult worry. We proposed two main hypotheses. The first one is higher levels of childhood trauma will correlate with higher levels of worry. And the second is childhood trauma will significantly predict adult worry patterns. Essentially, what we want to know is whether the emotional effects of early trauma continue to influence how adults think and worry about in the future. Our methods. So we surveyed about 846 adult participants from across the United States using an online data collection method. About 80% were female and 17% were male, and most identified as Caucasian, making up about 50%. And then it was followed by Hispanic, African American, and Asian participants. Participants ranged from young adults to middle-aged adults, with the mean age being 25. Most of the participants had at least a high school diploma or a college education. So what did the participants do, or what did they complete? So they completed two main instruments. The first is the Childhood Trauma Questionnaire, or CTQ, which measures five categories of trauma: physical abuse, emotional abuse, sexual abuse, physical neglect, and emotional neglect. The second questionnaire that they completed was the Penn State Worry Questionnaire, which measures how often and how intensely people experience worry in daily life. When we conducted the results, both instruments demonstrated strong internal reliability, with the Cronbach's alpha being above 0.85. So for our results, a Pearson's correlation showed a significant positive relationship between childhood trauma and adult worry. That means that as trauma scores increased, so did the worry scores, right? So we also ran a simple regression analysis, and these results were significant. Um, on the screen here, there is an R squared score, and the R squared score means that childhood trauma predicted about 2.7% of the variance in adult worry levels. While that may sound small, it's very meaningful, especially when you consider how complex emotional processes are. Even a small predictive link suggests that early trauma experiences can subtly shape our adulthood through the patterns long term. So what does this mean? So what this means is our findings supported both hypotheses. Adults who reported more childhood trauma also tended to worry more in adulthood. This aligns with previous studies in my literature, which I found similar links between trauma, worry, and emotional avoidance. These results especially supported the avoidance model of worry, which proposes that people use worry to mentally avoid strong emotions. For trauma survivors, worry can serve as a coping mechanism and a way to feel in control of uncertainty or prevent further harm. But over time, this constant mental activity can become exhausting and interfere with overall well-being. There are few limitations to mention. The sample size was mostly female, which may limit generalizability across genders, but most participants were Caucasian, and data collection was also conducted online, so it may not represent a full diversity of experiences. And because we use self-report measures, there's always a possibility of underreporting or biases. So speaking about this, future studies should include more diverse samples or even just use longitudinal designs to kind of track these effects over time. As far as implications, clinicians should be aware that individuals with a history of childhood trauma may experience elevated worry even if they don't meet criteria for anxiety disorders. This means trauma-informed therapy, CBT, and mindfulness-based approaches can help by addressing both emotional roots and trauma and the cognitive patterns of worry. And on a broader level, these findings can help inform public health prevention, education, and early intervention programs, emphasizing the need for safe, supportive environments that reduce long-term emotional burden of childhood adversity. In conclusion, this study helps bridge a gap in the literature by highlighting how childhood trauma continues to influence adult emotional life, not just through anxiety or PTSD, but just through everyday worry. Even when people appear functional on the surface, the mental habits that they developed to cope with early trauma, like constant overthinking or anticipating the worst, may reflect lasting patterns of emotional adaptation. So understanding this link as clinicians, educators, and policymakers will help us promote healthier coping mechanisms and improve long-term outcomes for those impacted by this trauma. Thank you so much for listening, and I'd be happy to answer any questions or discuss the implications further with any of you. I appreciate this opportunity, so thank you.